So now we will see the gluteal region. This is medial, lateral, superior, inferior. This muscle is gluteus maximus. After removing the gluteus maximus, you see the next muscle, that is gluteus medius. The key muscle of this region is this one, that is piriformis. Below the piriformis, the structures can be seen here. This is sciatic nerve. Medial to the sciatic nerve, posterior cutaneous nerve of thigh. Medial to that, this is inferior gluteal nerve. You can see some part of inferior gluteal nerve here, along with the vessels, inferior gluteal vessels. Above the piriformis, this is the nerve, superior gluteal nerve, and also the vessels here, that is superior gluteal vessels. Superior gluteal nerve supplies gluteus medius and minimus. Inferior gluteal nerve supplies gluteus maximus. This is sciatic nerve. This tendon here is obturator internus. Above that, superior gemellus. Below that, inferior gemellus. Below it, this muscle is quadratus femoris. Now we will see the structures called pin structures. So in the pin structures, you will see this one, first one. This is nerve to obturator internus. Then this nerve here, that is called pudendal nerve. Pudendal. Then there is a vessel which is deep here. This is nerve to obturator internus, pudendal nerve. There is one more structure deep, that is internal pudendal vessels. Okay, so this is a posterior compartment of thigh, superior, inferior, medial, lateral. You can see the superficial structures. This is deep fascia, fascia lata, and modification of fascia lata, that is called iliotibial tract, to which gluteus maximus is attached. Also there is other muscle which is on the anterior aspect, that is called tensor fascia lata. Both are attached to the iliotibial tract. Gluteus maximus, sciatic nerve, posterior cutaneous nerve of thigh. The muscles are semitendinosus, semimembranosus, long head of biceps femoris, short head of biceps femoris. And this area is popliteal fossa. You can see the upper part of popliteal fossa, where it is bounded by semitendinosus supromedially and semimembranosus. Supralaterally, it is biceps femoris. Inferiorly, popliteal fossa has got boundaries. Infralaterally, lateral head of gastrocnemius, along with a small muscle, that is plantaris. Inframedially, medial head of gastrocnemius. This is popliteal fossa. The structures here are popliteal vessels. This is sciatic nerve dividing into tibial and common peroneal nerve. Popliteal vessels has some branches here. This is superior medial genicular vessels. This is superior lateral genicular vessel. This is inferior medial genicular vessel. And this is inferior lateral genicular vessel. There is one more vessel here, that is middle genicular vessels, that is below the superior medial genicular vessel. This is posterior compartment of thigh in other specimen: superior, inferior, medial, lateral. Gluteus maximus. Gluteus maximus. Sciatic nerve dividing into tibial, common peroneal. This is an early division. Posterior compartment of thigh. The muscles are long head of biceps femoris. This is short head of biceps femoris. Medially semi-tendinosus, semi-membranosus. And this region is popliteal fossa again. This is tibial nerve, common peroneal nerve, popliteal vein, popliteal artery, gastrocnemius. This is lateral head, this is medial head. So the boundaries of popliteal fossa are supralaterally biceps femoris, supromedially semi-tendinosus, semi-membranosus, infralaterally lateral head of gastrocnemius, and this is infromedially, that is medial head of gastrocnemius. So in the posterior compartment of leg, the superficial fascia, we see this structure, that is sural nerve. Sural nerve is a branch of tibial nerve. Now sural nerve accompanies this vein. This is small saphenous vein. Small saphenous vein drains into popliteal vein. This is small saphenous vein draining into popliteal vein. Now we will see the muscles. The first muscle here is gastrocnemius. Gastrocnemius has got a lateral head and a medial head. We will cut the gastrocnemius and reflect it superiorly and inferiorly. We will see some structures here. So this is the tibial nerve. And this is popliteal vessels. And this muscle is soleus, which is deep to gastrocnemius. One more muscle that you see here, this muscle, which is hiding behind the lateral head of gastrocnemius, that is plantaris. Now gastrocnemius and soleus, they together form tendon, that is called tendon of Achilles, which is attached to the calcaneum. After reflecting gastrocnemius, the soleus can be seen. Soleus has to be reflected by cutting the tibial attachment of the soleus and reflecting it laterally. So you see the deeper aspect of the soleus. You will see some structures. These structures are this one, that is tibial nerve. Along with tibial nerve, there is a vessel, that is posterior tibial vessels. We will see it in detail. So here tibial nerve, and this is popliteal vessels. So this is popliteal vein, popliteal artery. Popliteal artery divides into anterior tibial. This is anterior tibial. Anterior tibial. And the continuation of this artery is posterior tibial. So anterior tibial and posterior tibial. Posterior tibial, it divides here at this point, and this branch is called as peroneal artery. So popliteal vessel, popliteal artery, anterior tibial, posterior tibial, dividing into peroneal, and this is your posterior tibial continuation, which is accompanying tibial nerve. Peroneal artery supplies the lateral compartment of the leg. Tibial nerve and posterior tibial vessels, it goes to the sole. Now moving on to the flexor compartment. Here, this is medial malleolus calcaneum. So there is flexor retinaculum. After cutting the flexor retinaculum, structures can be seen from medial to lateral. The first structure here, that is tibialis posterior. The next structure here is flexor digitorum longus, tibialis posterior, flexor digitorum longus, and this vessel is posterior tibial vessel. This nerve is tibial nerve, and this tendon here, that is flexor hallucis longus. So the structures from medial to lateral are tibialis posterior, flexor digitorum longus, posterior tibial vessels, tibial nerve, and flexor hallucis longus. We will see the posterior compartment of leg in other specimen: superior, inferior, medial, lateral. Now we will see the structures of posterior compartment of leg. So the muscle here is gastrocnemius, two heads. This is medial head, this is lateral head. After reflecting the heads, you can see the next muscle, that is soleus. Below the lateral head of gastrocnemius, this is lateral head of gastrocnemius, and this is medial head, lateral head. So below the lateral head, there is a muscle, that is plantaris. You can see the plantaris tendon that is intervening between gastrocnemius and soleus. This muscle is soleus. After cutting the soleus, we can see the structures. This is the tibial nerve, branch of sciatic nerve, tibial nerve, and this is common peroneal nerve, tibial nerve. There are muscular supply by the tibial nerve to the muscles of the leg, posterior compartment of leg. And this structure here is popliteal vessels, popliteal vein, popliteal artery, okay, start. This is popliteal vessel, which is having a vein and an artery below. So this is artery here, branch of popliteal artery. This is anterior tibial artery. Further continuation is posterior tibial vessel. Posterior tibial vessel will give a branch that's called peroneal artery. This branch is peroneal artery, and this is the continuation of posterior tibial vessel. Posterior tibial vessel accompanies tibial nerve. This is another specimen. You will see the structures. This is inferior, superior, this is medial, and this side is lateral. This is medial malleolus calcaneum. So there is flexor retinaculum here. The structures here are from medial to lateral. Tibialis posterior, flexor digitorum longus, posterior tibial vessels, tibial nerve, and the last structure is flexor hallucis longus.